All right. And so you touched on mask. Talk to me about the proper way to wear a mask.
Okay, so first of all, I see a lot of people put it underneath their nose.
Yeah.
No, you want to put it above your nose. Okay. I know I saw a couple of people were like just one side down, or just holding it. You really want to put it behind your ears, above your nose. You want to cover your chin also. So.
You want to make sure that you clip the nose piece
Yes.
as well.
Okay.
And then if you're wearing some type of surgical mask, those little folds will go up toward your face, because the idea, you know, when you're in surgery is that when you bend down, if you've got some mucus, it goes down into the little pockets. So those pockets face up when they're against your face.
Okay.
Out.
That's correct.
If you're on a plane and you want to eat, take a bite, put your mask back on.
Right back
Yes.
on. Yeah.
Right back on.
And so the movement that you just did is, because a lot of people pull from here, so it's best to lift because you're still keeping your nose.
That's how I like to do it,
Right.
because
Yeah.
I feel like my nose is still covered, most of my
Yes,
mouth is
yeah.
still covered.
Right.
I'm just gonna sneak my chicken nugget in there. And
So what do you say to people when they say, I have this mask on, but I can't breathe? It's hard for me to breathe.
Think about having coronavirus and you're
Yeah.
not being able to breathe.
Right.
It's going to be really hard for you to breathe. you know,
Right.
if you get complications from the virus.
Right. Right.
So-
Absolutely. Great. All right. So talk a little bit more about long haulers.
Okay. So there's this chronic COVID syndrome, or long haul COVID, where people will recover from coronavirus as far as they don't have any more, they're not positive anymore, they're breathing okay, or they're out of the hospital, but people will have fatigue. Long term, people will have decreased exercise tolerance. Some people do have some residual shortness of breath, a long lasting cough. You get, some people have heart issues, as far as like a heart failure or a cardiomyopathy, which is like a disease of the heart, weakening of the heart, that for some people has gone away. Some people are still dealing with it a year into the pandemic. The technology and the reasoning behind the vaccine is not a new thought. We had all the major minds in the world working on one specific problem, so it came about really quickly. What the vaccine, depending on which vaccine that you get somewhere between 60 to 95% of the people in the initial study did not catch clinical coronavirus symptoms after their shot. After the first vaccine, I think depending on which one you get maybe like 60% immunity after 2 or 3 weeks. And then after your second shot, 2 weeks after that second shot is when you are gonna reach that 95%. There's still studies ongoing to tell us whether or not, or how long the immunity lasts for. But so far, it seems like that 95% number is holding up.
Okay.
And the goal, you know, with the vaccines is to reach that herd immunity level where we've got 70 to 80% of the population either getting the vaccine or getting the coronavirus. And we're hoping that more of the population gets the vaccine rather than the coronavirus.
Okay. Okay.
And that'll protect the community.
Absolutely. Absolutely.
Yes, and every single vaccine that is out keeps people out of the hospital, keeps people from dying, and that's the major endpoint that we want.
That's a good point. I think one of the things that's important to educate is the amount of task and stress on our hospital systems, our healthcare systems.